And we're going to continue with our muscle labs, and so this is going to be your second muscle lab video, and our third one if you count naming muscles. And we're going to talk about the trunk and the abdomen. So let me get it up and going. Again, I'm just following along on your list of muscles. If you watch the YouTubes with Meg Graham, it's the same set of muscles. She locates them on the models for you, and then I'm going to give you a little more detail about each one. I really hate this pen sometimes. Okay. Muscles of the trunk and abdomen. So the first one on your list is the trapezius. And yes, you have to learn how to spell these muscles because it'll be fill in the blank on your exam. And your trapezius is this trapezoid-shaped muscle, so it's named based on shape. It's on your back. Big muscle that makes up your upper back. And it's two muscles, so this is one of them, and then this is the other one, okay? It's like a diamond shape. And you'll notice there's fibers going this way, and there's fibers going this way. And so this muscle does several different things. If you look at these muscles, one thing I want to tell you is the origin. You have an origin on the occipital bone. You also have an origin along your vertebrae. So this one has two different origins, one along the occipital bone and one here. The insertions are on the scapula, they're over here, and the clavicle. So this muscle can do several different things. If you're contracting these sections of the muscles, it's going to bring your shoulders back. Okay, so think about they're pulling. Here's the origin, here's the insertion, so it's going to pull your shoulders back, and that is adduction of the scapula, because you're bringing the scapula closer together. You're bringing them closer. So remember, abduction is away. So you're adducting the scapula. All right. If you use these muscles, this portion of the trapezius, and contract this way, remember this is the origin, the insertion's down here, so it's going to do this, it's going to shrug your shoulders, okay? And so you can use the trapezius almost like four different muscles. You can do each section independently. I can shrug this side, I can shrug this side, I can take that shoulder back, I can take that shoulder back, I can take them all back at the same time. So you can use this muscle in more than just one way. So remember, shrug shoulders, adduct scapula. The second muscle is your latissimus dorsi, so, which we call our lats. If you're thinking about you guys that exercise, you want to do your lats. So this is your latissimus dorsi. Well, dorsal means on the back. So this is the muscle based on that's located on the back. And this muscle here, so it goes from here all the way down to this really, really, really big muscle on your back. So it goes from the lower back and it goes all the way up, and it actually attaches to the humerus. The origin is going to be along your spine and along the ilium of your hip bone. So this is the side that doesn't move, so your spine doesn't move, origin, this doesn't move. The insertion is all the way up under your arm and under your humerus. So when these muscles contract, it actually brings your arm back down. And the best movement I can associate with it is if you do the butterfly stroke in swimming, the power stroke that brings your arms down, that's your latissimus dorsi. So your arms are up, you bring them down, pull down your arms, that's your latissimus dorsi working to bring those arms down. Now the muscle that raises your arm is actually the deltoid. So in the butterfly stroke, your deltoid brings your arms up, latissimus dorsi brings your arms down. That would make them be antagonists. They do opposite directions. So those are your two big muscles on the back. Muscles on the front, I think I wanted to show you that you could see the latissimus dorsi here. So there's your latissimus dorsi. Your next muscle is your pectoralis major, and then paired with that is your pectoralis minor. So pectoralis major and minor. And I'm doing them on either side because that's where they are. Here's the pectoralis minor, and here's the pectoralis major. Now on this particular model, they have basically cut away the layer of muscle on this side. So your pectoralis major is your most superficial muscle, it's the one you can feel. This is your pectoralis major. If you take that away, peel it away, you can see your pectoralis minor. So these are your pecs. Okay? So the origin of the pectoralis major is your sternum and clavicle. The insertion is over here on your humerus. So what happens when you contract these muscles, so this is the origin, it's going to pull this way. It's going to pull your shoulders in like this. Well, what happens is my scapula are moving away from each other. So they are being abducted. So it abducts your scapula. Okay? Abducts your scapula, brings your shoulders and arms in like this. Like you're going to, like when you're cold. That's what's going on there. So if your trapezius brings your shoulders together in the back, and your pectoralis brings your shoulders together in the front, they are antagonists. Now the next muscle is your pectoralis minor, so major meaning big, minor meaning smaller. And the location of the pectoralis minor is right here, and you can see it attaches to ribs. So the origin is actually ribs, and the insertion is actually up here on the scapula. So this is the origin, and this is the scapula. And it actually can help to pull the ribs out when you're inhaling. So again, it's another muscle that can help you breathe. If you don't know how breathing works, which you may not, basically think about a syringe. So if you have a syringe and you pull the plunger from a syringe, you're creating space, which creates a vacuum, which sucks air or whatever you're sucking into a syringe into the syringe. That's the way you breathe. You have a big diaphragm that's right below your ribs. So when it's relaxed, it's like a dome. When it contracts, it flattens out. So when it flattens out, creates space, sucks air in. So anything that you can do to expand your rib cage, to expand your lungs, to create more space, creates more vacuum. So normal breathing is usually just your diaphragm, just contracting, relaxing, and bringing air in. And when you take a really deep breath, you want to really expand your rib cage, so your pectoralis minor and your sternocleidomastoideus, they're going to really be pulling on your rib cage to open it up, create more space. Take a deep breath. Now when you exhale, that's just relaxation. That's just passive. That's just recoil. All the muscles just kind of relaxing, pushing that air back out. There is something called forced exhalation, and I'll talk about that in just a minute. But generally, breathing is active, inhaling is active, exhalation is passive. You just relax. Okay, so your next muscle is called the intercostals. Remember, this is named based on location. Costals is ribs, inter is between. So these are the muscles that are between the ribs. So I think I've got a picture here. Yeah. You've got two sets of intercostal muscles. And they aid in breathing. Now, your external intercostals, they're going to help you with inhalation. So they lift the ribs. And your internals will help you with forced expiration. So if you were breathing, your external intercostals will contract, pull those ribs out, create more space, allow you to inhale. When you relax, the air just comes out. Now, I want everybody to take a deep breath. I want you to let it out. Now I want you to blow more air out. Keep blowing, keep blowing, keep blowing. Okay, that is your internal intercostals, pulling your rib cage closer together, squeezing your lungs to push more air out. So think about when you blow a balloon, you're going to use that set of muscles. So typically you don't use those muscles a whole lot. So you've ever noticed if it's a birthday party and you're going to blow up 150 balloons, by the end of the day your ribs are hurting? It's because you're using a set of muscles you don't usually use. You're forced exhaling using muscles that you're not used to using, and they kind of get sore. All right, the next muscle is the serratus anterior. And this one's based on a shape name and a location. So anterior means what? Front of the body. Serratus means serrated, like a serrated knife. It's jagged. So see this little muscle here? It looks like a jagged edge. That's the serratus anterior. It looks like it's braided into your abdominal oblique muscles. So this little jagged muscle here is your serratus anterior. I think I have another picture. You can see it here, little serratus anterior, and you can see it on this model. So that's your serratus anterior. And the origin of the serratus anterior is the ribs, and the insertion is the scapula, and so it will actually abduct the scapula, okay, and pull them forward. So it works with the pectoralis major, so the synergist, and it works opposite of the trapezius, so it's an antagonist. So as you're learning these muscles, pay attention to which one's pulling which way, so you can know which ones are working in opposite directions, okay? And I've given you a hint on several of these. I've put them on your lab guide for you. All right, your next set of muscles is your rectus abdominis. And a lot of times people misspell this. They want to say abdominis with a U. It's abdominis with an I. So abdominis, however you can remember to spell it, but it's rectus abdominis, not rectus abdominis. Abdominis, so it's an IS. Rectus means straight. Abdominis means abdominal, so it's the straight muscle on the abdomen. So it's got a shape name, rectus abdominis, based on location. And so you have two, and so here's one, and here's the other one. This one's covered with that fascia I was talking about earlier. You have a white line called the linea alba that goes right between those two muscles. And you've got some other connective tissue but that makes it look like you've got a six-pack or an eight-pack. So this is not separate muscles. This is one long muscle and one long muscle connected by this connective tissue. The function of these is to allow you to have graded movement. So what does this muscle do? Let me tell you where the origin and insertion are and see if you can figure it out. The origin is down here on the pubic symphysis. Where's that? The pubic bone, right? The insertion is your xiphoid process. So this is the origin. This is the insertion. These are your muscle fibers. When it contracts, what's going to happen? It's going to pull your body over. So it's going to basically flex your torso. It's going to pull this end closer to this end or bend you over. Now, if you didn't have these little pieces of connective tissue, when this contracted, you just flop over like a rag doll. But by having these little pieces of connective tissue, it allows each one of these sections to kind of work separately so that you can just bend over a little bit. Okay, so you have graded flexion, which is kind of handy. Nice little feature that you've got there. You can also use your abdominals when you're breathing. If you've ever been a singer, they'll say, breathe from your abdomen. Well, they're actually talking, use those abdominal muscles to help support your breath. And it will actually help the diaphragm to inhale. And if you want to take a deep breath, put your hand on your stomach, on your abdomen, breathe in, and you'll feel those abdominal muscles working when you take a deep breath. Alright, so the next part is you have layers of the abdominal wall, so we're going to basically take away the rectus abdominis and see what's underneath there. So we've got the rectus abdominis, and now we're going to tear that away and look and see what's underneath. And you have three sets of abdominal wall layers three layers of the abdomen. There's the external oblique, the internal, sorry for that oblique, and the transversalis. So the external are going to be your deeper, they're going to be just deep to your rectus abdominis, but they're going to be the most external of the three layers. The internal are just below that, or just deep to that, and then the transversalis are the deepest layer. So you can see, let's see, I think I've got these oblique muscles here, here, and here. Alright? So your external obliques, the fibers run this way. And actually they attach, they're superficial. Here's your rectus abdominis, here's your external obliques, here. Okay, so their fibers are running this way. Pull that layer away, and the fibers that run at an angle the other way, that go toward the sternum, those are internal obliques. So the external obliques, the fibers run toward your belly button. The internal obliques, the fibers run toward your sternum. And then deep to that, you have the transversalis, and those are the muscle fibers. They run across your torso. So they're going to run that way. Let's see, I think I have another picture. Yeah. So these are your externals, the fibers running towards your belly button, the internals running up toward your sternum, and then if you take both those layers away, go even deeper, you're going to see a layer that goes across because your transversalis. Now, all these muscles kind of basically work to help you twist and flex your torso. So if you're going to do crunches, you're going to crunch to the side, you're going to be using your oblique muscles. And so they help you with flexion and twisting of the trunk. They also all work together to compress the abdomen. So if you need to go to the bathroom or deliver a baby, you want to compress the abdomen, because if you want to decrease the amount of space inside your abdomen to push something out, you would compress all those muscles. So think about the movement you would make, either pushing a baby out or going to the bathroom, having a bowel movement. When you press your abdomen together, that's going to force something out. So it's going to compress your abdomen. It also plays a role in posture. So it's one of your postural muscles to help you stand erect. The last two muscles, I don't have a picture of them. Okay, so you look in your book. There's some in your book. Yeah, I don't have a picture. And that is your levator ani. Sorry about that. And your diaphragm. And there's a picture in your textbook, and if you look, you can see there's the levator ani. It's basically the muscle that elevates your pelvic floor. So if you look in your, I think there's a picture in your textbook. I'm back. So if you take the model, you were basically to remove, and let's just show you how you would find it inside in the model. You take all the stuff out and look down inside the pelvic cavity, and there's basically a muscle down there, and that's the levator ani. And the only picture I have is the one in your textbook, and I just forgot to add it to your PowerPoint, so you can look in your textbook and find it. And what it does, it elevates the pelvic floor. So again, take all your organs out. If you look down in the model, it would be there. Now, what it does is, if you'll look in your textbook, you'll see that there are basically, you'll see your anus, and the vaginal opening and the urethral opening on female, just the anus and urethral opening on the male. And this muscle helps to hold up this pelvic floor. So if this muscle gets weak and starts to sag, it's going to pull on these sphincter muscles, and they're not going to be able to close as well anymore. Okay? And so you're going to have problems. You're going to have what's called incontinence, either fecal incontinence or urinary incontinence in females, because you can't close that sphincter anymore because the levator ani is kind of pulling against those sphincter muscles. So there's an exercise called Kegels, which basically you just kind of squeeze your pelvic floor together, kind of like you're going to try to stop urinating, that same movement. And that will strengthen that pelvic floor, keep those sphincter muscles where they're supposed to be, and help decrease pelvic or a urinary incontinence. This is really common in women who've been pregnant and delivered a baby vaginally because it kind of stretches that whole area out. It's also very common in people that are overweight. If a bunch of weight in your abdomen that's pushing down on that pelvic floor, it tends to stretch it out. So the more weight you've had, the more likely that muscle is going to be stretched out and not be very effective. So make sure you do your Kegels. You want to keep that muscle in shape so that you don't have problems down the road with incontinence. And the last muscle is the diaphragm. And I do have a model. So here's the model. And the diaphragm is this muscle. It's what separates the thoracic cavity from the abdominal cavity, and it's right here. And it's your main breathing muscle. And it is a skeletal muscle because it is involved in moving the bones, the ribs, and breathing. And it's also voluntary, so that's another reason it's a skeletal muscle. You can control your diaphragm. Now, normally it's doing its own thing without you thinking about it, but if you want to breathe fast or breathe slow, you make that choice so you can control it. So that's the last of your muscles of your trunk muscles. All right, take a break, come back, we'll do arms and legs.